Right now, while you watch this, there is a bacterium living in the stomach of roughly half the adult population of this planet. It survives in gastric acid, it penetrates the stomach lining, it causes ulcers, and the World Health Organization classifies it as a Group 1 definite carcinogen, the same category as asbestos, tobacco, and benzene. Its name is Helicobacter pylori. This is not rare. This is one of the most common infections in human history, and in many people it stays completely silent, until it does not. But on a small island in the Aegean Sea, 24 villages have been cultivating a natural resin for 2,500 years. Adding this resin to the standard antibiotic protocol raised the eradication rate from 63% to 92%. The process is precise. They make small cuts in the bark. The tree releases clear droplets. These fall to the ground and harden into small crystals. This resin is called Mastic, popularly called the Tears of Chios. Here is how it works. H. pylori does not live in the open stomach acid. It hides in the mucus lining that protects your stomach wall. Then it uses a tool, an enzyme called urease. That enzyme converts urea into ammonia. The ammonia neutralizes acid in a tiny zone around the bacteria. It creates a protected pocket. Inside that pocket, the bacteria survive. Not for days, not for months, for years, even for life if untreated. Your immune system responds, but it cannot fully clear the infection. So, it does something else. It contains it. That creates a low-level chronic inflammation in the stomach lining. At first, you may feel nothing, but over time, that inflammation starts to change the tissue. Normal lining becomes inflamed. Inflammation becomes damage. Damage becomes atrophic gastritis, where the stomach lining begins to thin. Then, in some people, the cells begin to change form. This stage is called intestinal metaplasia, and from there, in a percentage of cases, cancer develops. This process is slow, often 20 to 40 years. Many people who develop gastric cancer were infected in childhood. The disease shows up decades later. That is why this infection is dangerous, not because it kills fast, but because it hides.
Doctor, how widespread is H. pylori right now?
Roughly half the adult population carries it, many without knowing.
Half the world sounds extreme. Why is it so hidden?
It stays silent for years while damaging the stomach lining.
What kind of damage are we talking about?
Chronic inflammation that can progress to ulcers and cancer.
Now here is the part most people do not know. Testing is simple. A urea breath test can detect it. A stool antigen test can confirm it. No surgery, no complex procedure. Yet many people with chronic stomach symptoms are never tested. In 2023, a published clinical trial found that adding this resin to the standard antibiotic protocol raised the eradication rate from 63% to 92%.
If it is that dangerous, why are people not tested?
Awareness is low, and symptoms often appear late. Standard therapy works, but not in every case now.
So we need better support options?
Helicobacter pylori is responsible for more than 3/4 of all gastric cancers worldwide. Gastric cancer kills more people each year than either breast cancer or prostate cancer. And gastric cancer is, in the overwhelming majority of cases, caused by a single bacterial infection that most people have never been tested for. Wow! This is Chios Mastic, the tree resin that the Byzantine emperors priced at gold, that Ottoman sultans killed to protect, and that your gastroenterologist has almost certainly never mentioned. Subscribe to Ancient Lost Vault and hit the bell right now. Because in this episode we are going all the way through the science, the history, and the exact step-by-step protocol the clinical trials actually used. Stay with me. A 2025 study published in Nature Medicine, analyzing data from 185 countries, confirmed that 76% of all gastric cancers worldwide are directly attributable to this one bacterial infection. The infection rate is highest in Africa, parts of Asia, and South America. But it is present in every country, in every population, on every continent. A 2024 global meta-analysis found that roughly 44% of adults worldwide currently carry the bacterium. That figure was over 52% before 1990. It has been declining, but it remains one of the most prevalent bacterial infections in human history. H. pylori has been evolving resistance to both clarithromycin and metronidazole at accelerating rates. By 2015, the American College of Gastroenterology recommended against standard triple therapy in most regions because eradication rates had fallen below 80%. More than 1 in 5 courses of treatment now ends in failure. And the bacterium the treatment failed to clear is now more resistant to the next course. That is the problem. Drop H. pylori. In the comments right now if you have ever been tested, or if you suspect you might have it and have never been checked. Subscribe to Ancient Lost Vault. Every episode is evidence-based, sourced, and honest about what the data actually shows. Stay with me for the Mastic. On the southern coast of the Greek island of Chios, a stretch of land roughly 8 nautical miles from the Turkish coast, grows a low evergreen tree called Pistacia lentiscus var, the mastic tree. For over 2,000 years, farmers there have harvested a natural resin from the tree called Pistacia lentiscus var. The process is precise. They make small cuts in the bark. The tree releases clear droplets. These fall to the ground and harden into small crystals. This resin is called mastic, popularly called the tears of Chios. It has been used since ancient Greece for stomach disorders and oral health. That history is interesting. But history is not enough. What matters is data. In 1998, researchers tested crude mastic against H. pylori in the lab. It did not only slow growth, it killed the bacteria, even some resistant strains. That led to human studies. In 2010, a small randomized trial tested mastic alone in infected patients. Doses ranged from 350 milligrams to 1 gram, taken 3 times daily for 14 days. Results showed eradication rates around 30 to 40%. That is not strong enough to replace antibiotics. But it proved something important. Mastic has real antibacterial activity inside the human body. So researchers asked a better question. Not, can it replace antibiotics, but can it improve them? In 2023, a randomized study followed 180 patients with confirmed H. pylori infection. 2 groups. One received standard triple therapy. The other received the same therapy plus mastic, 350 milligrams 3 times daily. Same duration, 14 days. Results were clear. Standard therapy cleared the infection in about 63% of patients. The combination cleared it in about 92%. That is a large difference. One addition, same antibiotics, higher success. Researchers are still studying why. Mastic contains many bioactive compounds. Some appear to disrupt the bacterial cell membrane. Others reduce inflammation in the stomach lining. Less inflammation can make it harder for the bacteria to persist. Now, if you are dealing with stomach issues, here is how to think about this. First, do not guess. Get tested. If you have symptoms like persistent burning, bloating, nausea, or unexplained weight loss, ask for an H. pylori test. Step-by-step usage guide. Step 1. Confirm you have the right product. Chios Mastic must carry the EU Protected Designation of Origin stamp. If the packaging does not show this, it is not Chios Mastic. It may be resin from a different Pistacia species with an entirely different compound profile. The clinical data does not apply to it. You are looking for the specific certification mark from the European Union on the label. Chios Mastic comes in two forms: whole resin tears, small pale yellow crystals, and powdered mastic in capsules. For oral health and breath, whole tears are used. For H. pylori or digestive use, capsules are required. Here is why. When you chew mastic resin, the active compounds are largely absorbed through the oral mucosa and metabolized before they reach the stomach. The whole tear form does not deliver therapeutic concentrations to the gastric environment. Every clinical trial studying H. pylori used powdered mastic in capsule form, taken orally, so the resin travels intact to the stomach. Step 2. The Oral Health Protocol. For teeth, breath, and gum health, take one small mastic tear, approximately the size of a pea, and place it in your mouth. It will initially feel hard and crumble into small pieces. As you continue to chew, the resin warms and softens into a single, cohesive, gum-like texture. Chew for 15 minutes. Research has documented a greater than 40% reduction in oral bacterial plaque from this single practice. The primary bacterium responsible for tooth decay, Streptococcus mutans, is among the organisms Mastic inhibits. This is what Hippocrates was prescribing 2,400 years ago when he called it a remedy for the corruption of the teeth. One session per day is the historically documented and research-supported use. Step 3. The H. pylori Protocol. Capsules only. If you have a confirmed H. pylori infection and are currently on a prescribed antibiotic protocol, do not stop the antibiotics. The 2023 trial that achieved 92.2% eradication used mastic as an addition to standard therapy, not a replacement for it. The dose, consistent across multiple clinical trials, is 350 milligrams of Chios Mastic 3 times daily. Take one 350 milligram capsule before breakfast, one mid-afternoon, and one before bed. Spacing the doses evenly through the day maintains more consistent gastric levels of the active compounds. Duration in the trials: 14 days, matching the length of the antibiotic course. Take the mastic capsules for the same 14 days. You are taking the prescribed antibiotics. Mastic is extremely well tolerated. No serious adverse events have been reported in any clinical trial to date. Some people report a mild, pleasant aromatic sensation. It does not interact with proton pump inhibitors in any documented negative way. After completing treatment, confirm eradication with your physician using a urea breath test, the standard non-invasive confirmation method. Do not assume treatment has worked without confirmation. Step 4. Where to buy. In the United States, Chios Mastic is available in Mediterranean grocery stores, Greek specialty shops, Middle Eastern food markets, and in health food stores, primarily in the supplement aisle. It is sold as an unregulated dietary supplement, which means quality varies. Purchase only products that display the EU Protected Designation of Origin certification. For capsule form, ensure the label specifies Chios Mastic gum and lists no additives or fillers in the mastic content. The resin is also available directly from the Chios Gum Mastic Growers Association, the official cooperative of the 24 mastic villages, which ships internationally. Step 5. Important clinical notes. Mastic is not a diagnostic tool. If you have stomach pain, acid reflux, or signs of an ulcer, persistent burning, nausea, loss of appetite, unexplained weight loss, see a physician and get tested for H. pylori first. A urea breath test or stool antigen test can confirm or rule out infection non-invasively. Mastic is not appropriate as a substitute for medical care in cases of confirmed ulcers, gastric bleeding, or advanced gastric disease. Before you go, click the next video on your screen right now, because hair loss affects more than 80 million Americans, yet most people only hear about minoxidil and finasteride. But a recent scientific review turned attention to something far older, He Shou Wu, a Chinese root used for over 1,000 years and now being studied for its possible role in hair regrowth. Researchers looked at how it may affect multiple pathways tied to hair follicle health and why this ancient remedy is drawing fresh attention in modern hair loss research. The claims are intriguing. The lab data is interesting, and the human evidence is still developing. If you want the full breakdown, click the next video on your screen now. Subscribe to Ancient Lost Vault and hit the bell. Share this episode with someone whose stomach has been giving them problems, because the test to find out if you have H. pylori takes 20 minutes, costs almost nothing, and most people have never been offered it.